My name is Dr. Maryl Johnson. I'm a professor of medicine and heart failure transplant cardiologist at the University of Wisconsin in Madison. And I just finished my presentation at the International Academy of Cardiology meetings.
You want to say it again? Yeah, we'll say it again.
Fine.
Yeah.
Okay. My name is Dr. Maryl Johnson. I'm a professor of medicine and heart failure transplant cardiologist at the University of Wisconsin in Madison, Wisconsin. I just finished my presentation at the International Academy of Cardiology meetings in Boston, and that presentation was about whether new studies and devices actually tip the balance toward implantation of left ventricular assist devices earlier in patients that require assistance for destination therapy. Over the past couple of decades, we've really advanced the management of heart failure in many ways, but there are still some patients that really don't respond to the medical therapy and aren't candidates for heart transplant. And our options for those patients are quite limited, although what has been shown to be beneficial is the use of a left ventricular assist device that's actually implanted in the body to do the work of the left ventricle and allow these patients to actually have a longer survival and a better quality of life. However, at the present time, this therapy is very limited due to the long-term complications that these patients have, and the different devices have had different studies to change management protocols as well as improve the devices to hopefully allow more patients to benefit from this therapy. The first device that was used for destination therapy as a continuous flow device, which is the current standard, was the HeartMate 2, but it was found in a period of time in around 2011 that there was a lot of bad thrombosis and requirement for actually exchanging the devices surgically, which is a big deal to have to do. And so there were some group of investigators that got together and looked at best practices, both in terms of the surgery as well as the management of the patients, and found that indeed different surgical techniques, earlier initiation of anticoagulation, modulation of pump speeds, and particularly control of blood pressure with a systolic blood pressure measured by a Doppler cuff, or a mean blood pressure measured by the Doppler cuff being less than 90, that decreased the risk of thrombosis and VAD exchange, in addition to hemolysis. There's also a device called the HeartMate 3 device, which is a newer generation device that is a centrifugal flow pump that's implanted into the left ventricular apex. This device also has additional factors in that the rotor is actually magnetically levitated, as well as there are speed changes that occur every few seconds that actually hopefully wash the blood flow pathways of the device and decrease the risk of thrombosis and clots forming. And indeed, that was shown to be the case when this device was compared to the HeartMate True axial flow pump. Another device that's been out there is called the HeartWare HVAD. This is made by a different company, also is a centrifugal pump, and they actually did a study comparing it to the standard pump at that time, which was the HeartMate 2 axial flow pump, and found that although the overall outcomes were similar, the device that they were using, the HeartWare device, had an increased incidence of stroke, and certainly having a 30% incidence of stroke is something that patients don't want to look at, and this was over a very short term. So similar to the other studies that were done looking at patient management, they looked at their patient population and found that centers that were actually doing a better job of controlling blood pressure had a lower risk of stroke, and indeed supplemented the trial with additional patients, an endurance supplement trial, and found that with better blood pressure control, the risk of stroke came down to a much more acceptable level and indeed comparable to the HeartMate 2 device. Interestingly, there's been a recent start of using what they call the LVAD cycle in the HeartWare device, and this actually is a similar speed modulation to what occurs in the HeartMate 3 device, and that actually has been shown to have some benefits as well in terms of thrombosis, as well as a tendency toward a decreased risk of bleeding, primarily GI bleeding, and this is the first trend that we've seen in that, which patients will really benefit from if this indeed shows to be the case. One of the real challenges that remains, however, with ventricular assist device therapy is the expense. And what has been looked at is that for this to really be cost effective, even in the sickest of patients, we need to do better with patient management and decrease patient readmissions. And so this is something that we really need to do to tip the balance toward use of these devices in patients that are not quite as ill for destination therapy.